Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Rosemary Eseh-Logue. She's an internal medicine physician, and today's KevinMD article is titled, What is Intersex? What do you know about your patient's sexual development? Rosemary, welcome to the show.
Thank you for having me, Kevin.
We'll get into your article in a little bit. Just first off, briefly share your story and journey to where you are today.
Yes, so I am an internal medicine physician. I am originally from Nigeria. I went to medical school in George Washington University in DC. I did my residency in Texas at Baylor College of Medicine, and I currently fully utilize my internal medicine degree. I teach, I do inpatient, I do outpatient, and I have my own practice.
All right. So tell us a typical day, because I'm an internal medicine physician myself. I do outpatient primary care. And as you know, a lot of physicians, they're just kind of specializing either all inpatient or all outpatient. But you seem like you have that traditional practice doing it all. How's that going?
Well, so I'm doing it all, but in their own section. So on Mondays and Tuesdays, I teach. I teach residents in the clinic, and then on Thursdays and Fridays, I'm usually doing hospital work, and then kind of mixed in between there, I'm doing my own practice work.
All right. And for those medical students who may be listening to you now, what are some reasons why they should consider internal medicine as a career?
Well, so internal medicine is the place to be because with internal medicine, you really can expand your field of practice. Take me, for example, I'm able to basically practice in whatever setting because I have a diverse enough knowledge base.
All right. So let's talk about your Kevin MD article. It's titled, What is Intersex? What do you know about your patient's sexual development? Now tell us how your article came together.
So, one of the things I discovered is that a lot of residents are not even aware of the word intersex. They've never heard of it or they don't know what it means. And so this is important because especially in our current culture where we need to be culturally competent, you cannot provide culturally competent care if you don't even know the person that is in front of you. And so that is a really important gap in knowledge. And so I really wanted to take the opportunity to really educate, residents and fellow physicians about intersex. And it's not unusual because I didn't learn about this, and it's just surprising that many years later the residents are not learning about that either.
Sure. So let's start there. Can you please explain the concept of intersex?
Right. So intersex, these are people, that's almost 2% of the population that are born with genetics, biology, anatomy, hormone panel that does not fit our stereotypical understanding of male or female, which we assign at birth.
All right. And what are some misconceptions or stereotypes that's associated with intersex individuals?
Right. So one is that if somebody is intersex, then that means that they identify as gay, which is not correct. There are people who are intersex, but they do not identify as being gay. And so that's one. So in the LGBTQI acronym, the I stands for intersex. So that's one. The other thing that people don't understand is that basically all intersex are transgender. Transgender either to their biology or to society.
And can you give us a little bit of demographic information in terms of the intersex population?
Right. So intersex is about 1.7% of the US population, or really the population that is intersex. And so that's, 17 out of every 1,000 births. Most people are diagnosed when they are in their teenage years or adult years, but there are some that can be diagnosed when they're born or even before that. It is important to be aware that there are people who are intersex and what that means for our practice.
Now, from the perspective of intersex patients, tell us some of the psychological and emotional challenges that they face when they seek care in our healthcare system.
Right. So a lot of intersex population feel stigmatized because of their gender identity, which can be in conflict with what either we as professionals or family members or friends expect it to be. And so there is a lot of anxiety and depression and just fear of being getting biased care. So a lot of them don't actually even come to for medical visits, and when they do, it's just not it's a stressful situation, which it shouldn't be. And this, it's so important that we recognize this because a recent study showed that in intersex population, about 40% of them have attempted suicide. And one of their contributing sort of triggers, if you will, is just the way the outcare community treats them. And I think that's just not really acceptable for a physician, for a community of professionals who heal.
Now, teach my audience like you teach your residents about the intersex population. What are some things that we should know in the exam room when we talk to our patients? So just give us some advice and walk us through a typical encounter.
Right. So one of the main things to understand is that there's a lot of diversity in what we call intersex people. Some have, you know, changes that we can't see. Others have some that it's clear that, okay, this person is intersex. And so we have to go into it with that curiosity that we don't know what this patient's particular, uh, anatomy is. And so it's to ask. So one of the things to say is, what do they identify as in terms of, you know, uh, gender, male, female, none, both. And then the other thing you want to do is to say what surgeries have you had? In other words, you want to find out what organs are present and what organs are missing. So for example, you may have a patient who is female presenting. They look like what we stereotypically call a female, but then when you ask them, hey, tell me about your surgical history, that's a very neutral way to ask to get more information about the intersex anatomy, if you will. And so when you do that, then you find out, oh, they had their testicles taken out some years back. So now you're gonna say, whoa, what's going on, right? So it clues you in that, okay, I might be dealing with an intersex person, and so I need to dig, so I know what body parts they have, because this is important for screening. There's certain screening that we would need to do that you may miss if you're not aware of certain organs that a patient has.
What are some other surgical procedures that the intersex population would typically undergo?
Right. So some can have breast implants and some can have mastectomies. So those who identify as male and have developed breast, you may find that they have had mastectomies. And so that would be a reason to say, hey, why did you have that surgery? Those are one. And then in terms of the genital organs, they can have implants put in, penile implants. So there are different surgeries that they can have done to have the genital be more appropriate for what they feel it should be.
Talk about some of the resources that's available to our intersex patients.
So in the medical profession, there isn't a lot. There's not a lot of physicians who either are comfortable addressing intersex health or feel knowledgeable enough for it. But there are support groups like Interconnect that supports people who are intersex and helps them to find resources both for medical care and also mental emotional well-being as well. For the physician, there are organizations like US Path or WPATH that give some information on how to care for somebody who is intersex.
Now, you mentioned before that there isn't a lot of training when it comes to treating our intersex patients in medical school or residency. How did you learn? What kind of resources did you turn to better equip yourself in managing intersex patients?
Right. So I basically started reading different books on sexual development, reading different articles and journals from the intersex community and from other organizations within the medical community. So urology is one of the specialties that tend to see a lot of intersex people. But yeah, so basically a lot of books, articles, journals, and then just online research and then connecting with the intersex community.
What is the perception of the intersex community as it relates to the physicians? Are they generally suspicious of a lot of physicians because they don't have a lot of exposure? How do you gain their trust?
So So there is a lot of mistrust for sure. There's a lot of fear as well, which is sad. So mistrust, fear, and also a feeling of incompetence. Because when they do go to a physician's office, the physician has never even heard their condition, let alone know how to manage it. And so a lot of them do voice that they end up having to teach their physician, which they're willing to do, but that mutual kind of understanding and trust sometimes is missing.
So, in terms of the common issues that come up when you see intersex patients, what are some common scenarios that, as an internal medicine, you will see in the exam room that you would have to address?
Right. So the main ones would be just in terms of assertism, patients who are presenting and they're just more hairy than what they would like for their gender identity. Another is patients who are on hormone therapy and so needing to manage them. So, for example, a patient who's taking hormone therapy so that they can be more in the female body that they feel is consistent with their gender identity, they're going to be on a higher dose of estrogen than what you would typically give a usual, postmenopausal patient who's on, estrogen. So those are things. That's one of the common ways that you see that it's not a mistake. They're on very, very high dose estrogen, and that's actually appropriate.
Now, you've talked about some of the things that we clinicians should do. Tell us some red flags. What are some things that we shouldn't do? What are some mistakes that you see when it comes to clinicians interacting with the intersex community?
So a big mistake, one that I still, make and I have to catch myself is we have to, basically let go of our eyes, which is hard to do. But a patient may present to you appearing like a certain stereotypical sex, but they identify as the opposite. And so we have to be mindful of, again, the pronouns that they use. There's one person, for example, that I know who does not like to use any pronouns. I'm going to use they just to protect their identity, but they would prefer to have their name. So use their name every time rather than use a pronoun. And the reason for that is because they actually do not have any of the organs that we typically associate with a male or female. They don't have testes, they don't have ovaries because of their particular condition.
And in that case, you just use their proper name.
Yes. And it's very hard because I find myself saying her because the default is female. Biology wise, if the body does not get that testosterone input in development, the default is a female looking body. And so my tendency is to say her, she, and I have to catch myself and be like, nope, use their name. And it's okay, right? Because you're learning. But that's one big mistake that we make. And it's important that we try to learn.
We're talking to Rosemary Eseh-Logue. She's an internal medicine physician. Her KevinMD article is titled, What is Intersex? What do you know about your patient's sexual development? Rosemary, tell us some of your take home messages that you want to leave with the KevinMD audience.
Yeah, so the main thing I want to leave is that it is important to know about intersex. We can learn about it. The data is out there. We just have to engage with it. It's not about our religious view or political view. That's not what this is. This is about understanding our patient's body, their anatomy, so that we can take proper care of them.
Rosemary, thank you so much for sharing your perspective, time, and insight. And thanks again for coming on the show.
Thank you. Thank you very much.